Okay, my name is Daniel Estaso, and I'm doing a Master of Public Health in Global, with a specialization in Global Health, and I'm taking this course Health 509, Social and Behavioral Health Theory. And a topic for this week or a topic for this discussion is the interprofessional, or what it takes to become a good interprofessional service member in public health. And as always, I always love to begin by a lecture of the week, the lecture that Dr. James Lawrence gave us. He started about talking um, about the Good Samaritan when he was approached by the lawyer. When he was approached by the lawyer, he gave that parable about the Good Samaritan. And in it, he brought about love, the love that the Samaritan showed to the person that was injured. And in it, he brought about what it takes to become a good healthcare professional. That healthcare professionals are the ones that solve a lot of the problems we face in the society in the field of health. They want to go and helping the root cause of most of our problems, where it begins by the choices we make every day. He brought about lots of statistics about smoking, HIV, heart disease, both in the United States and internationally. And he gave some amazing statistics. And in it, he brought about why we need to practice lifestyle changes. For example, he spoke about healthcare or public health declining in developing countries, like in the field of, like, for example, smoking. Smoking has increased in a lot of developing countries. He spoke about HIV/AIDS or other sexually transmitted diseases, and he spoke about heart disease. I mean, heart disease is becoming a very big problem, especially in the United States. And he said what it takes to change this again is a lifestyle changes, which brings us back to public health. Now, public health is the science of protecting and improving the health of people and their communities, achieved by promoting healthy lifestyles, researching disease, injury prevention, and detecting and preventing all diseases. Now, to begin, public health didn't just begin right now. It started in the olden days, in the Bible days, in the days of Moses. When Moses was managing the people, the Israelites, when he just brought them out of Egypt, the laws that governed them was the beginning of public health. He told them to always pick up after their remainings or after their waste, cover their latrines, cover their food, practice safe health or practice safe sex by not committing adultery. He also told them in the areas of what to eat, making sure that they don't eat they eat clean food and not eating unclean food. Unclean food was basically eating healthy nowadays. Like, if they had carrots in the days, he would advise them to eat stuff like that or eat a lot of more vegetables, less of fatty meat like what we eat right now. Basically, that's what he meant. So those now all those principles is what evolved right now into public health, where we exercise, we go to the gym, and we eat healthy. Now, going back to the topic, which is what it takes to become a good interprofessional service member of public health, I decided to also define what it takes to be. I decided to define what interprofessional means. So, an interprofessional approach to healthcare is a coordinated care of patients by a collaborative team of healthcare providers. It's split up in 8 different areas or 8 different domains. These domains are called the analytical assessment skills, policy development, program planning skills, communication skills, cultural competency skills, community dimensions, of practice skills, public health science skills, financial planning and management skills, and leadership and thinking skills. I'm going to talk about two skills here, which is the analytical skills and the financial skills, and a little bit about cultural competency, because they have a lot to do with what we do today. He also played a big role in the service learning project I did with the clinic. Now, to come back, the clinic in which I did a little bit of work on which I became a patient was a new chiropractic office I just started going to. And in the presentation video, the doctor spoke about he spoke about public. Basically, he spoke about public, what we do in public health, but he didn't really call it that way. He basically wanted to he discussed mainly about the problems of our healthcare system. He said you mostly go to see the doctor when when something is really seriously wrong with the body. He drew up a scale and said he drew up a scale from 0 to 100%, and 0 being worse or no health or death, 100 being perfect health. And he drew that most of us in this society fall about 60%. And that is because we only come to the doctor only when we have a problem. By that time, a lot has gone wrong in our body. And in it, he related to a nerves in the body, nerves attached to our nervous, to our cardiovascular systems, digestive systems, urinary systems. So all of them are attached to it. When something happens to one nerve, something goes wrong with that system. And a lot of us only come to the doctor only when something is wrong. So we don't take into account the time that those organs or systems are being damaged. So that's why we did public health. Because public health will change those lifestyle changes, those modifications we need to make sure that our bodies and everything is healthy. Our communities are healthy. Our communities as a whole are healthy. So that's why I started with the first competence skill, which is the analytical assessment skill, which has to do with understanding our needs. It has to do with understanding the needs of the community, taking note of what each community needs. I do a business on the side, and in that business, we have a team that basically mentors us and tells us what to do, how to progress in our business. And one of the most important points our team tells us is we have to understand the needs of the people in our business or the people we're trying to serve. Or if we're trying to serve a customer, we have to understand that person's needs. It's very important. We have to have a clear understanding. If we don't have a clear understanding of the needs of that community, we can't help them. We can't help to create policies that help them. So understanding needs is important. Another important need is our communication skills. We need to be able to communicate. Communication is not just speaking; it's understanding. It's learning how to listen. It's learning how to collect data and information and using that data in the right places. Another need is program planning needs, program planning skills. And program planning skills focuses on the needed policies and programs, because some programs are not important, some are important, some can be modified. Another need is a cultural competency skill. You need to understand culture. Culture is important. How one society operates may not necessarily be the same way another society operates. So if you don't learn to understand culture in an environmental culture within a certain environment, then we can't meet those needs. And another skill I really like to talk about, or the final skill I would like to talk about, is the financial planning and management skills, which basically has to do with budgeting and the flow of money. Now, in our business, they tell us we need to understand money. Money controls everything we do. how we live, where we go to, the car we buy, how we shop. The same applies in public health. We can't create good interventions if we don't understand the flow of money. That is also why in Dr. James' video, he mentioned that policies, policy intervention or public health interventions in developing countries are not very good. That's why there's more smoking over there in developing countries or more AIDS because of the policy interventions. We have to have good policy interventions in order to effect good change. So I hope this. I hope everybody understood what I was trying to say. This brings me to the end of the presentation. I'm happy working. I'm happy. I'm happy I worked with everybody in this class. I'm happy. I loved the presentations and the discussions. Hope to see you in another course. Bye bye.